Hello everyone, welcome to Smiley Denti. I am Dr. Prachi Mishra. Thank you for subscribing to our channel. If you have not subscribed, please do subscribe and do press the bell icon for getting all the notifications. In our earlier episodes, we've been answering your queries. So let's take this question and answer session further. So the first question for the day is, how safe are traditional dental x-rays and are the new digital x-rays better? So I had answered a part of this question earlier also. Dental x-rays are very safe because the dosage of radiation that they require is very minimal. It's very less, so it is very safe. And new x-rays, new digital x-rays are definitely much better than the previous ones, in the sense because the radiation that they require is even lesser than before. And also, of course, as technology is further progressing, so we're getting better and better results in dental x-rays. Next question: what happens if a woman has a dental problem when she is pregnant? Okay, so when a woman is pregnant, many times pregnancy can cause certain dental problems like bleeding gums, swelling gums. This is because during pregnancy there are certain hormonal changes in a woman's body which can lead to bleeding gums or dental problems. So you can definitely go for a dental checkup. Many times people get scared and they don't even go for a dental checkup during pregnancy, but you can go for a dental checkup during pregnancy. There are certain procedures and certain medications that are contraindicated during pregnancy. So your dentist will not give you those medications, but also there are many medicines which are safe and they can be safely taken during pregnancy, and if at all required, you will have to take them. There are certain procedures, dental procedures, that have to be avoided during the first trimester and the third trimester of pregnancy. That is the first 3 months and the last 3 months of pregnancy. Otherwise, your dentist will definitely, your professional dentist will tell you when you can get a procedure done, if at all is required. Our next question is, what if a tooth gets knocked out in an accident? Okay, this is a very interesting question. If at all, God forbids, you have an accident and get your tooth is knocked out. First of all, if it is a child, so you have to check if it is a milk tooth or a permanent tooth. If it is a milk tooth, then we don't replace the milk tooth back inside the oral cavity. If it is a permanent tooth, then try to get to your dentist as soon as possible. It can be the same tooth can be placed in the mouth. If you cannot get to your dentist soon, now the prognosis of this depends on how fast you get to your dentist. Meanwhile, till you get to your dentist, you can store your tooth in your mouth, in the saliva of your mouth. If you are not able to do that, then store the tooth in milk, not in tap water, in milk. Now hold the tooth from the crown portion, from the upper portion, from the chewing surface, not from the root. Now, because the root has certain fibers called the periodontal ligament, which are much needed for healing of the tooth. So please don't hold the tooth from the root, hold it from the crown portion, from the upper portion, from the chewing portion, and store it in milk, and get to your dentist as soon as possible. Now the nerve and the blood vessels that are damaged, they cannot be recovered. What your dentist will do, he or she will first do a root canal on the tooth. He will clean the socket, your tooth socket, and place the tooth in the socket, and then will stabilize the tooth in the socket with using splints, that is wires or composite splints, and eventually slowly the tooth will fix in your oral cavity. But the prognosis is not very good. It all depends on how quickly you can get to your dentist and what is the damage done during the accident. So I hope this video was informative to you, and I hope I was able to answer your queries. Please keep watching and please do keep sending your questions. Thank you.